But today I want to talk and examine exactly where we are as of today in regard to this virus, what the essential facts are. Then I would like to briefly talk about what I believe that we have learned in the last 7.5 months. So today, October 15th, these are the essential facts. Yesterday, we reported 2,039 cases, our record. Today, we are reporting 2,178 cases, another record. This is in stark contrast to not too long ago. September 20th, barely a month ago, we had 762 cases. And for some time, we were hovering around 1,000 cases. So we've gone up dramatically in a relatively short period of time. Number two, in addition to the increased cases, we're seeing more people get sick enough to be hospitalized. Hospitalization, of course, is a lagging indicator. And as we see more cases, we assume we're going to see more hospitalizations. But already, we're seeing a significant change. On September 20th, we had 563 COVID patients in Ohio hospitals. Yesterday, we had 1,042 patients, COVID patients in Ohio hospitals. So it's basically doubled in a short period of time. Number three, today, we add 13 new red counties, giving us a total of 29 red counties. That represents 65% of the population of the state of Ohio. 65% of us, basically 2/3 of us, are now living in red counties. Number four, in addition to our 29 red counties, we also now have 52 counties that are high incidence counties as of today. And again, want to define what that means. This means the county has more than 100 cases per 100,000 residents during the past 2 weeks. This number is the distinction that the CDC makes between a county with a moderately high level of spread and a high level of spread. So 52 counties, high level of spread. We certainly know that a high level of cases in the community means a higher risk of catching the disease for everyone. Number five, before we get to that, let's go directly, Eric, to the numbers, and we'll start with the summary. Again, as we said, 2,178 cases. Our 21-day average is still there, but it certainly is moving up as these numbers continue to go up. Reported deaths today, 5. Hospitalizations, 108, a little bit over the 21-day average. ICU admissions jumped rather dramatically with 43. Let's look at the next slide, Eric. This is our advisory. Last week, this is what the state looks like this week. Let's go to the next slide, Eric. So this is what we're looking at today. And again, the H simply means high incidence. So we're seeing a good part of the state in red. We're seeing very little of the state now. 7 counties that are in yellow. Let's take a look at the next slide here. And this is just putting the high incidence counties together with the red counties. Those are the ones that have color to them. And again, it shows that most of us live in a high incident county or a red county. Let's take a look at the next one, Eric. This shows the change. And we've taken each week going back to July 2nd and shown how many counties were in the yellow, what percentage were in the orange, what percentage in red. And so if you flip over to here, you see yellow is very, very small. We've got some of the orange, and then red is the biggest, pretty much that we have seen it. It was fairly high back on, looks like July 16th was fairly high there as well.